Hello everyone, good morning. Can you hear me? All right, thank you for joining us. This is actually my first time attending this coffee hour. I call it the age-friendly Seattle Coffee Tea Hour for those who don't drink coffee. So just want to also mention that I'm going to be turning 65 in a few months. I'll be joining one of the 30,000 plus seniors in this county, so I'm very happy to do that. In the meantime, I'm one of 21 volunteers on the Seattle King County Aging and Disability Services Advisory Council. And so the purpose of this meeting is that hopefully we have two public meetings set up. This is the first one. We're going to have another one later on. I'll announce it again. It's going to be in August. The purpose of this is to share what we're doing in terms of planning and program services. We will be, when this is all said and done in October, we will magically have this thick document that we'll send to the state of Washington as part of our funding reporting requirements. And it's a 4-year report, so we'll be doing that. So again, we're using this coffee tea hour to share and receive public comments on our 4-year area plan on the Area Agency on Aging, which is otherwise known as the Aging Disability Services programs. And this will be for the year 2020 to 2023. I think without further ado, I'm going to turn and introduce Kathy Knight, who is the Director for Aging Disability Services of the City of Seattle, but also of the AAA, which is the Area Agency on Aging. So her responsibility extends beyond the city. It goes to the entire county. We're one of 13 area agencies in this state. Okay, Kathy?
Thank you, Dick. Can you all hear me? Is this good? Great. Okay. I like to move around, might cramp my style, but is this where I look for our Facebook fans, Lenny?
Yes.
Facebook fans?
Yes. Sorry, we're trying.
Oh, technical difficulties. Where's the young kid when you need one, you know? Come on. All right. So you see our agenda for the day. We're going to try to cover a lot of ground really quickly. So you're going to get a very high-level overview. And then we can come back if you have specific questions about anything. So let's start right off at the bat with what is our mission, so that you know about aging and disability services. We serve all of King County. Yes, we are a division in the City of Seattle Human Services Department, but we have a partnership with the county, and we're the Area Agency on Aging and have been for over 40 years. So our mission, and does everybody have a handout? Right? Everybody have one of these? So you can follow along that way too? Great. All right, so our mission is to develop a community that promotes quality of life, independence, and choice for older adults and adults with disabilities in King County. And this goes back since the 70s. So the area agencies have been doing this for some time. We are chartered under the Older Americans Act, and that was passed many years ago. Some of us may remember 1965. I remember it. So under the Older Americans Act, our responsibility is to advocate, plan, and coordinate services for older adults. This is all over the country. We have over 600 area agencies on aging around the country. There are 13 in Washington State, so we're one of 13. We serve all of King County, and that's about a quarter of the state's population in terms of the distribution of funds that we get for Older Americans Act. So we have a lot of folks that we pay attention to. And we're guided by a 21-member advisory council in partnership with King County. And as Dick said, he's our vice chair. It's a great group of people. If you want something extra to do, we can always use good advisory council members. So we can talk about that later. All right, who do we serve? We serve the priority populations that are defined in the Older Americans Act. So the Older Americans Act was passed to serve folks 60 years of age and older, but with a focus on folks who have greater needs in terms of economic need, social, rural areas, minority populations. So we do, when it comes to services, we are expected to target to some of the greatest needs. We also do unpaid caregivers. That is new to the Older Americans Act since I think 2000. The state was already leading the way in serving caregivers. Really important people. I bet a lot of you in this room either have been or are caregivers to someone special in your life. And under a special arrangement that we have in the state of Washington, we play a very active role in supporting anybody who's 18 years of age and older, very low income, they're on Medicaid, they qualify for nursing home care, but they want to stay at home. So we have about 12,000 people in King County that we support every year through that program. Okay, this gives you a sense of the national network. It's sort of hard to read, but at the top is the President and Congress, and this is the year we reauthorized the Older Americans Act. So this very important piece of legislation that authorizes what we do has to be renewed every so often, reauthorized. So it's a busy year for us to be reminding our congressional representatives of how important this legislation is to helping people maintain their independence in the community as you age. And we have that legislation established a federal office for aging services. State units on aging were the initial kind of focal point for the dollars that we got through the Older Americans Act. When they brought in the area agencies on aging, we're the on-the-ground organizations since the 70s. And so you can see we do much of our work through a network of local providers. We contract for core services. Dick, did you want to do the numbers?
I'm actually not a retired CPA. I'm a practicing CPA, so I'm the numbers guy everyone turns to, unfortunately. But I'm actually into substance and people. So I'm gonna just touch on highlight some of the numbers. The budget that we have for current year, again, this area agency on aging plan, four-year plan, begins next year. We have to have a four-year plan that's mandated by the Federal Older Americans Act, and that plan needs to be approved by the state unit on aging. But looking at this year, the budget for the Aging Disability Services is $54 million, roughly. Just keep in mind that money is not so-called discretionary. There are many mandated programs that we have to fund using those funds. We have 125 contracts with 75 community provider agencies. You guys know some of the Asian communities, Chinese Information Service Center, Sound Generations in the greater community, and other programs. We have transportation, we have meal sites, and we have information referral services. We have legal advocacy work as well. So we provide services throughout the county. There's 201 Aging Disability Services staff, and they're not just administrators. Keep in mind that many of these outreach workers, case managers, working with in the Seattle Housing Authority and the King County Housing Authority housing, working with the older folks who are residing in those buildings, for example. I guess that's a 2017 number. We served about 48,000 unduplicated older adults in 2017. I'm sure we'll have some more current numbers. In terms of our funding, where that $54 million comes from, the majority of that, 55% comes from Medicaid, right here. Medicaid's 55%. Even though the reason why we exist, I guess the AAA, is because of the Older Americans Act, which is a federal legislation. Older Americans Act doesn't really provide us with that much money. They provide about 16% of our total budget. And then it comes with a lot of rules that we have to follow. So I guess it reminds me of this poster I saw when I was a federal auditor. And it shows a little boy sitting on a toilet and has a roll of toilet paper next to him. And the caption goes, the work's not over until the paperwork's done. So there are a lot of paperwork that we have to do in order to provide services and to get the money to the older adults like myself. State funds. State funds right here comes from the State Senior Citizen Services Act, and that provides about 12% of your state tax dollars to support the programs. City of Seattle has been a leader in funding senior programs, and the City of Seattle devotes funds about 12% using its general funds to support senior services. The service areas funded by us, there are certain areas, and I think those are the ones highlighted in red. Those are mandated. We have to provide those. And they include health promotion, which information campaign to help people with fall prevention, health and wellness, basically issues affecting older adults. Elder abuse prevention, protecting the rights of the elders from financial abuse or mental and emotional abuse. Family caregiver, I understand about 80% or 85% of caregivers are family members who are unpaid. And it brings to them a significant toll in terms of physical stress and emotional stress. So we want, much of our funds go to support those respite care, giving them a break from the daily chores of taking care of the elders. Community living connections, again, provide a number of senior services to the community as well as to agencies. And then finally, nutrition. Nutrition is another required funding program, and they fund meal sites, congregate meal program at senior centers, as well as Meals on Wheels for those who are homebound. And the rest are somewhat discretionary, and we have some money, roughly about 13% of our money. It's tough for me to talk about budgets for going forward because we don't really know what Congress will finally come through in terms of how much they'll be funding for us for next year. Going on to the next page. If you're a male living in King County, and if you're over 60, then you're one of the 16.5%. If you happen to be female, it's 19.6%. So we can tell already, 19.6 right here, female. 19.6% of the female over 60 are living in King County. 19.6%, I'm sorry. So you can already tell that the women live longer than guys. So end of the stronger sex anyway. So let's move on to the next one, and we will touch on some demographics. Age 60 and over by race. Some numbers. You have those numbers in your handout, so I'm not going to go through each of those individually. I encourage you to look at it. I'll just point out that the white population in King County is about 60%, but the folks, Caucasian people over 60, there's about over 60, they make up 75% of the older folks. The next map is the longevity map, which basically indicates the age, and the blue means you're living much longer. And you can tell the well-to-do areas versus the rural areas. It's a reflection of the so-called inequity. If you're well off and you're in an area where there's a lot of support services, you tend to live longer. And if you're in a rural area, socially isolated, dealing with chronic problems, you don't live as long. So that's just one of the many statistics that Kathy and her staff put together to analyze what we do and why we do it. Next slide talks about the projected growth of folks 65 and over. there's going to be it's significantly increased. I think from about 2018, you can see there are about 113,000 individuals in, let's see, that's within the state of Washington, 113. With dementia. With dementia, that's the key word. Dementia actually starts as early as age 50 something, so it's important to realize that. So within King County, there are about 30,000, and that's projected to grow to about 48. So the age wave is here. Folks are getting older, and unfortunately, they're also facing a lot of problems that we're struggling to provide funding for and address. Next, let's see, Alzheimer's. Alzheimer's death is also an issue we're dealing with. It's not something that's unique to us, it's across the country. Alzheimer's is a problem. Dementia is just a general term that includes Alzheimer's, is one of them, Parkinson's and others. So just to point out that the deaths relating to Alzheimer's. So the next one, overdose. We're working, the three partnership agencies is the King County Department of Public Health, the King County Department of Community and Human Services, and Kathy's department, Aging Disability Services within the city. We're trying to address, working with King County Public Health to address overdose deaths relating to older folks. Many older adults have to deal with chronic pain, and they have to, take pain medication. And one of the biggest problems is that they tend to sometimes forget or sometimes take more than they're prescribed. So it's an issue. I think those are all the numbers I have, and I'm going to turn this back to Kathy to go over the details.
Thanks, Dick. All right, so now we're going to get down to business about the area plan, so you know what's going to be in it. As we said, this is a 4-year plan, and it's required under the Older Americans Act. We have to submit it in October. And that's going to guide our work for the next 4 years. This is something that each AAA is charged to do, and it's important to note, the reason we do it is because we represent our local community. It's unique to the needs we identify in our community. This is why Dick shared all the data. It's really important for us to know the needs within King County. So we start off with the profile of the 60-plus population. And we wanted you to get some highlights of the kind of data that will be in the plan. That's what Dick was sharing with you, so that we really understand what we're talking about. We already know our service network. We've been developing that for over 40 years, so that's described in the plan. It's sort of our baseline, because we're going to be working on trying to meet some unmet needs in the future. So we're really going to address some current and emerging trends as part of our next 4-year plan. And we've broken it into 3 categories, sort of for thinking, and it's almost like on a continuum. Start with healthy aging. I think we have a lot of folks here who are part of that group. And that we want to continue to help folks stay independent, stay as healthy as possible. That's part of the whole age-friendly initiative. We want Seattle and King County to be a place that supports people as they age. So we have some issues that we're going to be looking at there. And then, so we need a little more help, but we want to be able to enhance everybody's well-being, regardless of what your needs are. And we want to maximize independence for people who need extra support. So we're going to talk about each of those sort of 3 frameworks for our goals for this next plan. And we've identified strategies to address those issues, and we'll have a budget to try to support those activities as much as we can, even though, as Dick said, funding is never enough. We're always struggling for that, but we can still make a dent. So if you look at the healthy aging focus, This is to help consumers age healthfully and avoid the need for services. Imagine being able to go through life and you're able to stay active, healthy, engaged in your community. And there's ways that we can support folks to do that. So some of the issues we'll be addressing in the plan. There's a lot we can do even if you have chronic disease, that you can manage that more effectively. Oral health is a big issue. We realize more and more affects your health, can even affect whether you get dementia. We know there's connections to that. And brain health and dementia-friendly communities. We now know lifestyle choices have an impact on the likelihood of developing dementia and Alzheimer's. And the built environment, that's really like, so you go in a home and you can get into that home if you're using a wheelchair. You can go down the street and navigate the street regardless of whether you need a walker or you're pushing a stroller. So that's sort of a fancy term for like when you build a house, think about building it so that anybody can live there, whatever their capacities. Social isolation, that's another big issue. So we have a few, some data, I think, in the next slide that supports that. Yeah, so we already know that a large percentage of people 65 and older do have at least one chronic health condition, but that doesn't mean you can't manage it effectively. And we have programs that help folks with that. We know that we have about 150,000 adults who have untreated, 60 and older have untreated oral health needs. And we are recognizing more and more how important oral health is. I can't stress that enough. We have about 117,000 people in Washington with dementia, and it disproportionately affects women and people of color. And I'm going to say, you're going to hear research in the years ahead about how we live our lives can really have an impact on our brain health as we age. And then we have many folks in Seattle who live alone, and a sizable percentage of those folks have a disability. So we now know social isolation is as bad for your health as smoking cigarettes. And so we're really looking at what can we do to help people stay actively engaged in their community and feel a part of the community. So we want to build awareness about the risks associated with oral health, social isolation, and falls prevention. I didn't even talk about that, but we know that's a big issue, something people need to be aware of. We want to expand chronic disease self-management education. These are great opportunities for folks through a kind of a support group approach to help each other manage and stay healthy even with a chronic condition. And we want to promote dementia-friendly communities. We've got to get away from the stigma about somebody having dementia. We have to diagnose it earlier. We have to provide support for people. There's a lot that goes into being a dementia-friendly community. And we need to encourage older people and adults with disabilities to fully engage in the life of the community. Come out to meetings like this. Be a part of it. So under enhancing well-being, we're looking at stabilizing, supporting our consumers, reducing dependence on our formal aging network services. So we mentioned caregivers, loads of caregivers, and with a little extra support, we can continue to support our loved ones without relying heavily on the formal system. Housing affordability. We will be talking about this endlessly because in Seattle and King County, it's a reality we live with. We don't have an easy solution. It's not, we don't fund housing services. That's not covered under the types of services that we're responsible for. But we do a lot to try to promote affordability and housing options, and it's going to be a big area of concern. There's a piece of legislation that just passed called the Long-Term Care Act. That's going to be mostly for younger workers who will now be putting money aside to help pay for if they need long-term support later in life. So that's just in the early stages, but it's something we want to really be paying attention to and planning for. So just for some of the data, we already know how many caregivers we have. Unpaid caregivers provide an enormous amount of care that, you know, if you monetized it, we're talking about $470 billion that the system that we're not relying on Medicaid to pay for. We do have a shortage of paid caregivers. We're going to have to be working on that in the future. We really are going to be needing more support and help there. Again, the housing issue, that is definitely contributing to us seeing more older folks who are becoming homeless. And I mentioned the Long-Term Care Act. All right, so some of our goals, we're going to coordinate with other local funders like King County, because the Veteran, Senior, and Human Services Levy is going to be infusing more dollars to help us with some of the services we already provide, like nutrition, health promotion. We're really looking at that partnership helping us extend the few dollars we receive to do more to help folks in King County. We're going to be trying to implement strategies that are in a report that was done that looks at the housing needs in King County. That's going to be real important. There's a lot of ideas there. And we feel like we have a very important role in making sure people understand this new long-term care benefit that people will be paying into. Okay, then we have the goal of, so for maximizing independence, we're looking at trying to help people avoid institutional care. And there's ways that we do that through transportation services, support for our senior centers, supportive housing. And some of this, relates, if you think about healthy aging, they relate for the full range. I mean, having access to transportation and housing is all very important for people who are trying to stay independent and are still relatively healthy. So, we have multiple transportation barriers for folks with special needs. Many have difficulties getting around, and so we definitely know we have issues in rural areas. It's a constant challenge around the state to meet the transportation needs. Senior centers are facing challenges in serving folks who have more complex needs. They're a very important part of our community, sort of a hub for folks and a place to go. But they have challenges in serving folks as their needs change. And we definitely need more coordination for affordable housing. And so all the work we keep hearing about the city and the county coming together to address the homelessness issue, we're hoping that we're going to see some efforts to address housing so that we don't have more people falling into homelessness. So we're going to support the coordination of available community transportation that we do have. We're going to support strong programming in our senior centers that, again, are very important parts of our community. And we're going to continue to coordinate with King County on the senior centers. They support senior centers too, and really trying to improve behavioral health services. We're seeing folks with greater needs in the area of behavioral health, mental health issues, and we need to do better to help those people. We're looking at a partnership with the tribes. That's a very important part of the work we do, and we want to ensure that we have greater success for our Native American elders in King County. We're looking at access to services, affordable housing, information about available resources. See, it doesn't work. So in our partnership with the tribes, some of the issues we're looking at is that in King County, there's about 40 different tribes. 10% are folks are 60 and plus, so they're seeing similar needs even at a younger age than we're finding in the older population. The urban American Indians and Alaska Natives are more likely to have a lower socioeconomic status and higher rates of disability, so they're going to need more support. And they lack of affordable housing for the tribes as well. And there's a lot of ways we can help people in navigating and accessing services. We talked about community living connections. That's a really important part of our network of services to help people access resources. So we want to do better in helping the tribes with that. We do that through what they call a 701 implementation plan that's done in collaboration with the federally recognized tribes. We identify training opportunities that are relevant to the individual tribes, and we coordinate efforts to connect with the King County tribes and organizations. So we will continue to do that. It's an important part of our role in the next 4 years. So today's a public hearing. We're going to be anxious to hear what you have to say. Our next one is August 5th. It will be at the Shag Tukwila Village. Between August and September, we're looking for comments from folks, and actually we probably have to have those by August 5th, don't we? Yes, though. We're going to be wrapping it up so that we can work on editing this comprehensive plan, pretty comprehensive with all the things we've been talking about, and get that to the state, meet our requirement of submitting our plan. Because again, we don't get our own American Act dollars if we don't submit our plan. So that'll be, yeah, we have a date there. So, I don't know how much time we have left. Oh, we have about 20 minutes, 15 minutes? Great. So, we covered a lot. There's a lot there. But we really would like to hear what you think about some of the areas we're focusing on for the next 4 years and suggestions you have.
I'm confused on what. I'm confused on the difference between AAA and ADS and how they overlap.
That is a really good question. Yeah, we are. Oh, I'm sorry. The question was, how does AAA, AAA relate to ADS? So first of all, I always make this joke. We're not the AAA you call when you need your tire changed. We're the AAA you call if you want to know where a meal program is or you need transportation to get there. So that's Area Agency on Aging. So we're very unique. I think we're probably unique in the country, because most area agencies on aging are either independent, what they call council of governments, where multiple counties will get together and organize as an area agency on aging. Several of our AAAs in Washington do that. Some are with counties, Pierce County, Snohomish County, Kitsap County. We're the only one that's a partnership between the city, and we do that as the Division of Aging and Disability Services. I'm echoing, why? So we are housed within the City Department of Human Services, and we have a partnership that has existed for 40 years that allows us to also be the AAA. So we wear two hats. We are a division within the city, responsible for aging and disability services, and we have responsibilities to the whole county. Very strange reason why that started. There's a long history, but in the early 70s, when the AAAs were first established, Seattle had a big infrastructure and had a mayor who was passionate about aging services. King County was still fairly understaffed and didn't have the structure, so he was a strong advocate for housing it within the city. But it does make it a little bit confusing for people. So in essence, ADS is AAA. We are the same thing, one and the same.
Is this the number that we call for any questions we have?
The question was, we have a number for community living connections in your handout. Yes, and I always know the number because it's on my We can get you one of these. Yes, that's the number you call. If you have any questions, that's a great place to call. You want to know about resources, services, somebody in need for information. What do you think about our priorities? What do you think about these issue areas? I want to hear that.
I gave a big thumbs up. Those are really important. Enhancing wellness, preventing disease, preventing falls. Those are all really important projects.
Oh yes. So we got a thumbs up on our priority areas because it is really important that we are promoting healthy aging. You know, this is the first time in history that people are living so long. We call it the longevity bonus. And we're having to change how we think about a lot of things because nobody thought about so many people living so long. And this age wave is wonderful. And we have, like I said, lots of opportunities for people to stay engaged and involved. but it also makes us more aware of all of the things we need to do to try to stay as healthy as we can, and to have the services in place to support people to try to be as independent as possible and stay in the community for as long as possible. That's where I hear everybody would like to stay.
So my name is Denise, and I am a geriatric social worker that works at the Wallingford Community Senior Center. And I just want to emphasize the importance of housing that I am seeing, and the number of older adults who are becoming homeless or trying to struggle to stay in their homes. So the housing piece and the transportation piece is so key. And I guess I would also encourage the city and the AAA to speak to the ADS case managers to see what they're seeing, as well as talking to seniors in the south end of the Seattle and King County, and just making sure that everybody's voice is heard.
Thank you. I didn't get, because of time, we didn't really go into the work we've done in developing the plan in terms of trying to get out and talk to lots of different groups, organizations, stakeholders. And Karen Winston actually did go and meet with our case managers. They do what they call a monthly info share. And she came to the Renton office, and she was in the Seattle office. And it was a really excellent opportunity to hear, because you're right, they're out there every day with folks who are trying to stay at home with major challenges, and we got some really good suggestions that helped us in setting our priorities. I don't know. Yes. Oh.
I would like to know what has happened to the kind of questions I used to ask senior rights assistants, which were legal questions, sometimes who to turn to in the state for consumer issues where you felt defrauded, etc. Does this number deal with some of that, or do you want to talk about some of the history and services?
Well, I'm not the expert on legal services, but you're right. If you call Community Connections, they can help connect you, but also there's a clear senior hotline. I thought that still existed. There is a way for folks to contact and get information for legal assistance. And I'm not the expert on that, but I know we are funding those services. We do get, it's not a whole lot of money, but legal assistance is one of the priorities in the Older Americans Act too. I feel like my mic's not working, is it?
It is.
I can appreciate that there are a vast amount of needs, but looking at the plan, I noticed how frequently transportation is a key component, yet in the overall plan, it seems to have a lesser importance. And I, for one, think it's vitally important for seniors with medical needs or social.
The question or the point had to do with transportation services and how critically they are needed in a variety of ways, but particularly like getting people to medical appointments. And we actually, as I mentioned before, we get limited funds, and we do have some areas that we're mandated to put those dollars. Transportation is an area that we are really using our dollars to try to fill gaps. So we actually are looking at helping to fund transportation services to get people to meal sites. Because nutrition, good nutrition is one of the first steps in trying to stay healthy as you age. Also medical appointments. And I know, if you're on Medicaid, you have options, but other folks in the community can still use help. And so we just finished an RF, what we call a request for proposal process, and have issued the dollars we do have available to try to fill those gaps. But I totally agree, transportation, this is a national issue. We hear it all the time. And we try to rely, again, this is where we try to work in partnership with our transportation providers, like the Seattle Department of Transportation and King County. They're the folks who in many ways are responsible. That's their job, and we need to try to encourage them to do better and fill gaps where we can. And I hope my staff feels free to jump in anytime if I'm not making enough of a point about something.
Thank you.
My question is, what age do you consider to be a senior?
Okay, so for the Older Americans Act, if you are 60 and older, you're considered, if you're eligible for services under the Older Americans Act. We had a discussion, I go to a monthly statewide meeting with my counterparts, and we had a discussion about the tribes and looking at it's more realistic to have an age of 55 because folks are experiencing the challenges of aging at a younger age. And what are some of the other programs? Do you have other yeah.
Metro buses is 65.
Metro is 65?
Different ages.
Right. You know, your safest bet for a lot of things, people think of 65 because of Medicare. And so, but yes, the Older Americans Act, because it was a different focus, much more on recognizing those supportive kind of wraparound services, you know, picked a little younger age, so it does get confusing.
Two questions here. Two questions back here we're going to go to. So right back in the back here and then right here. So back in the back first and then to you. So
Your mic.
My name is Lidia Shakramanova, and I live on Minor Street, 430 Minor Avenue. I understand that the city and the state have a lot of problems, and I also have a problem that I wanted to mention. It's maybe not big in comparison. So I live at... So I live in a housing facility for seniors and people with disabilities and people with low income. And so I don't have a problem with the housing, but my issue is that I am the only Russian speaker in the building.
Языком я ограничена. Я сюда приехала 8-10 лет назад. Мне это 89 лет через месяц, и английский изучить уже достаточно не в состоянии.
So I'm very limited by my language. My language. I came here about 8 to 10 years ago, and I'm going to be 89 very soon, and it's very difficult at my age to learn English.
В силу того, что я в этом доме единственная русскоязычная, у меня очень ограниченное общение даже с живущими в моем доме, с моими соседями.
And due to the fact that I'm the only Russian speaker in my entire building, I'm very limited in my ability to socialize with anybody else in my building, even my immediate neighbors.
В связи с этим я обратилась в организации, которые занимаются этими вопросами, с просьбой обменять жилье в тот дом, где живут мои близкие друзья, живут много относительно русскоязычных, чтобы поменять жилье.
So I actually went to the organization with a request. I made a request to change apartments so that I could live in a building where I have a lot of close friends and there's a relatively large number of Russian speakers. I just wanted to change and live in a different building.
Мне ответили, что этот вопрос мне решить невозможно в силу того, что закон не позволяет. Я и жилье, которое я хотела бы перебраться, где мои друзья и знакомые, разные эрии, не то там.
So the answer that I got was that was not possible to do, that this was not something that the law would allow, because the other building where I had some close friends and other large number of Russian speakers, I was told it's like a different area or it's a different department and that it was impossible for them to switch me to that other building.
Исходя из того, что в жизни невозможного нет, я задаю вопрос в итоге. Можно ли мне в этом вопросе помочь хотя бы с помощью ваших усилий самой мэрии города Север?
So, because I understand that there's nothing in life that's truly impossible, I'm asking whether I can get some help from your organization, from the mayor of the city, to help me resolve this issue.
We're going to talk to you after the meeting. Lenny's going to talk to you. We're going to sort this out. I'm really interested. We're almost out of time. I'm very interested, since we're almost out of time, in making sure that people who want to make comments about the plan and what we've identified in the plan have a chance to do that. I mean, people are welcome to stay after is it 11? After 11, but I just want to make sure people get their chance.
A comment from the group, Amharic speaking group, is this is a very necessary and excellent program and information sharing, and we are also part of this community and are being served by these services. We appreciate everything being done to us. Although there are some shortcomings, if we get opportunity, we would like to talk about.
Thank you very much. Yeah, we have several staff. We never even talked about the number of languages that individuals that are on our staff can speak and can provide assistance to different communities. So I'm glad to hear that we're able to support you, and we're always happy to hear how we can improve.
Oh yes, this man, I'm in sympathy with her. Because the city and county do redline people. They stick you someplace and they know you don't want you there, and then they'll say something like, oh, you can't move because of this. You know, we live in senior housing. We die every day, so there's a space available every day. They got to clean the apartment every day. So don't they give this woman what she wants? She's the only one that's 89 years old. I'm 69 on it though, I admit that. But like, I'm in the same situation. I got a brain, you know, like, I want to leave Washington State, because Washington State is stuck in 1947. I'm gonna say pre-1967. You know, when Red Line was ended, running that thing, we going right back to that, telling you how to act, where to act, and all you experts, you just there for the paycheck and nothing else. And then make a show.
Well, I think this is an issue we need to explore a little more with some of you folks, so we'll have to do that.
I have a question about how can we help advocate with our legislators for the upcoming vote on the Older Americans Act? What can we do? This is critically important.
Thanks for that question, because that is so important. The legislation needs to be reauthorized this year. We have fantastic leadership. Senator Patty Murray is a co-sponsor of the bill. But it would be great if you called or wrote a letter to your congressional delegation. You can send it to both senators, Maria Cantwell, Patty Murray, and whoever your congressional representative is. Is it Pamela Jayapal? Is she primarily in the Seattle area?
Yes, she is.
And I think it's just important for them to hear how much you think the Older Americans Act does to help support people to age with dignity and stay a part of the community. So it's really important to get that message to them. Also, we get appropriations every year, which aren't enough. That's when they give us the funding. Can always ask, please ask for increases there. Some of the services you've talked about us needing to do more about, we could address with more funding. So that's that. I think it's always good to let our state legislators know that you think the work of the area agencies on aging is so very important, and they should be continuing to support the state funding that is part of those programs. And then, you know, city council, county council, they need to know that we are an important, you know, the area agency, through the federal and state dollars we get, we bring a lot of resources into the county that help improve the lives of older adults. And so any way you can express that you support our work and you want it to, and you want to see it continue, I think that's great.
Do you have any idea when that legislation is up?
Well, it's that right now, people, you asked about the legislation. Yes, actually, the legislation will expire in September. So it's authorized through September of 2019. However, the last time it expired, it took them 5 years to reauthorize it. So, you know, Congress has a way of keeping things going. But there's a lot of momentum this year, I think, to try to really get, it's popular bipartisan legislation. It's feel-good legislation because you're helping people who have contributed to our country, who want to stay active and involved and safe. And so we're hopeful, but you know, Congress moves very slowly, and there's lots of other things going on. So they're taking comments on the proposals in the bill. Our national affiliate has offered their suggestions. They're trying to look at what they say, modernizing the Older Americans Act a little bit. So if you are a political junkie and you want to know more, I can help you. It is 11 o'clock. So I don't know if we should officially end the forum and then answer questions, or people want to stick around. I don't know. One more question.
Я хочу поблагодарить вас за ту работу, которую вы проводите, и за ваши прекрасные отношения к нам пожилым.
I want to thank you very much for the wonderful work that you're doing and how wonderfully you treat all of us, all the great services that you provide to us.
Thank you very much. I like that. Let's end on a positive note. And we are happy to answer any questions if folks want to stay after and talk with us. Thank you so much for being part of our public hearing.